Hello, I'm Dr. Dave Esham, and I'm a credentialed cosmetic dentist in San Diego, California. In the following video, you're going to see how we can transform smiles without grinding on your teeth with a procedure called BioClear U-Veneer. Hello everybody, I want you to meet Catherine. She's a beautiful young lady, but was not happy with her smile because she felt like her smile was narrow and she felt like she had worn her front teeth. And she was from Los Angeles, where she meets and sees a lot of people because she's a writer of murder mysteries of all things. And so she wanted a brighter and more profound smile, but as she investigated what it would take to get that profound smile, she found out that, porcelain veneers would cause her to need to have to grind on her teeth. In fact, as she investigated further into the internet, she found out that at least about, a fingernail's thickness of her tooth would have to be taken off from at least the front sides. She also found that porcelain veneers were very expensive and they cost, quite a bit of money. And for someone who was just emerging in her career, she felt like that was a bit too much. So she did some more investigating and eventually found that there was something called a BioClear U-Veneer that can be done to help her get the smile she wanted, but not have to grind on her teeth and not have to spend a lot of money. So that's what led her to me, and she drove over 2 hours from Los Angeles to see me here in San Diego. So we're going to go over her story on how she got this smile. We're going to tell you how we did it. We're going to show you how we did it so you can understand the benefits of BioClear U-Veneer to you and see how conservative it is and how beautiful a smile can become without having to grind on your teeth. So watch the rest of these videos to see how Catherine gets her profound smile without any grinding and at less cost than porcelain veneers. The next part of this video discusses Catherine's smile problems and our solutions. So again, this is her smile. It's narrow and it has very worn edges for somebody as young as Catherine. Up close, you can kind of see the edges are all worn, and there's usually a point here and a point here, and through the stress in her life, she had worn that all away. She didn't like the color of her teeth, and then she wanted a little bit wider of a smile, something that filled out her whole lip. So we met, had a consultation, and went over some of the things that I thought would help her get her smile without having to grind on her teeth. So up close, again, very worn, different lengths of these two teeth in the gum. We'll eventually go over and take care of that. Same different length here versus here, and we'll take care of that. And so we did a thorough analysis of Catherine, looking at her eyes, looking at the midline of her face, and seeing how her teeth line up within her lips. We always design our smile to fit appropriately within someone's lips. We want the smile to fill out the sides, and we want the teeth to be upright, and then we want the edges of these teeth to be somewhat horizontal to the eyes, and when you look at those edges, there'll be a curve that follows the curve of your lower lip. So these were the treatment steps we put together. We needed to pick a shade that Catherine likes, and we'll show you how we do that. And then we need to pick a nice length of her teeth, so we did that also. Here's what I drew up when we did our consultation. I talked to her about widening her smile, lengthening these teeth back to what they used to be, giving her a little point on this cuspid, and then blending a nice symmetrical width of her smile from right to left, along with forming that little line I talked about where you look at the edges of her teeth and her smile follows the curve of her lower lip. In summary, we're going to be lengthening and widening Catherine's teeth, along with whitening and blending so it fits within her lips. In this next section, we talk about cosmetic imaging and how it helps you get your best smile by showing you what you would look like without us touching your teeth. After that, we did an imaging. This is a computer imaging on this side of Catherine's teeth. And we'd like to show our patients this, not that it would be perfect for them, but something that will give us a baseline of what they want. And we're really glad we did this for Catherine, because we saw when we showed this to her that she thought these teeth were a little bit too white and maybe they looked a little fake, and she didn't want this translucency that's in these edges. And so that's okay, we can make those adjustments. What she did like was the width and the symmetry, and she liked the line that these teeth made in her smile and how it looked on her face, and again how it followed the curve of her lower lip. So sure, this wasn't perfect, but it let us kind of focus in on what she eventually wanted. And so this digital cosmetic imaging is very helpful, and we do it for all of our patient consults when we're discussing multiple teeth. And the reason why we do it is because that way the patient can get an idea what they're going to look like and help us individually plan the smile design that patient will want, and it won't be a surprise. So cosmetic imaging lets you see your smile before you decide on any treatment, and helps us make sure you are happy with your smile at the end of treatment. We want you to be happy with your smile at the end, so we let our patients see this shade on their teeth before we get started. So after getting the information from the imaging and the patient saying it was too white, we know what the patient would like in her final smile. So before we start her BioClear U veneers, we try in the shade and show the patient what it would look like. To do that, we use the U veneer template and different colors of our 3M composite bonding material and put it over their teeth so that they can look at it and choose which shade would make them most satisfied with their smile. For Catherine, we tried in B1, WB, which is white, and XWB, which is extra white. She chose WB to give her the most bright smile, and yet it still looked natural. By allowing our patients to see the shade and choose the shade with us, we ensure that our patients are happy with their smile at the end of their treatment because they've been intimately involved. Because our patients see their shade in their mouth before we get started, it ensures that they'll be happy with their shade or whiteness at the end of our treatment. Let's go over the warm injection molding process so you could see why the BioClear U veneers are a strong restoration that will last a long time. And we start getting ready to warm injection mold. To explain warm injection molding, it is a method where we heat up tooth-colored filling material called composite, and we actually inject it into these forms. And it makes for one piece. It's not layered like bonding. Bonding is layered and there's multiple pieces that are laid on top of each other, but that sets you up for bad bond strength and also for air bubbles and also for staining down the road. So that's why bonding has a bad name, is because it's weak and it stains, and it's weak and it stains because it is multiple pieces laid onto your tooth with cold composite. We use warm composite, and we warm injection mold so it's all one piece. This is the flowable composite being injected into the BioClear matrix. You can see I'm filling it all the way up to the tip. And then we're doing warm flowable composite on the adjacent tooth, all the way up to the edges. And then now we're going to inject a full body paste of composite over the tooth so that we get that, we push this flowable composite deep into the tooth and around the tooth so that we get a great bond and a great seal with no margins. Again, warm injection, molding further, and then finally we get the full surface of the tooth covered. And then we go over the incisal edge, and we do the other tooth into the incisal edge. So we have both these teeth warm injection molded with tooth colored composite. But we're not finished here. Next, we smooth it, and then we use the U-veneer to slide under these matrices. We slide under it with the U-veneer and then push our material even further against the tooth, ensuring that we get a great bond with no air bubbles. So that's the U-veneer sliding under the matrices and pushing the material further into the tooth. And then we're doing the adjacent tooth with U-veneer with a little bit of flowable composite to help it flow better. And we push that into the tooth, and you can see we end up with some excess. We clear up that excess, and then we cure the teeth, and they kind of look like this when we're done. But this is all one piece, warm injection molded, no seams, and a great bond to your tooth. Close-up picture. Next, we would clean off these. Take these off, pop these off, take the matrices off, and it looks like this. When we take the matrices off, you can see how smooth the surface that it leaves. But from time to time, there's little places where we need to add, and so we'll add those before we start shaping these teeth. We're tucking it in to make sure there's no air bubbles, and then we cure, and then now we can start trimming and contouring our tooth so it looks like a natural tooth-colored front tooth. As you can see, warm injection molding is all in one piece, which makes it strong and stain resistant. And after polishing, finishing, and contouring, it is a beautiful restoration that will last a long time for you. So we have warm injection molded the teeth, and now we're going to trim them and contour them so they'll look like natural teeth. And contouring our tooth so it looks like a natural tooth-colored front tooth. Obviously these are too big, so we know we have to trim them back, and so that's what we do from here. And it takes, an artist that happens to be a dentist who happens to be trained in cosmetic dentistry like me to be able to do this. So you want to make sure you go to somebody who has experience and has the training and has the skills to give you a nice looking front tooth after they're warm injection molded. So I'm trimming this up and shaping it to make it look more natural and not quite so big. Using a disc, we use a diamond, we do the facial surfaces, we do along the gum line so that we have a nice clean margin along the gum line. And then now we're getting our teeth to look more like central incisors. They're still a little too big, but that's okay. We'll be taking care of that. And then we trim, we carve, we shape, we trim some more. And then now these two are about 80% finished. And that's when I stop, and then we start doing the other two side teeth. So we'll do those next. And then here it is warm injection molded, and we removed all the matrices. And the other lateral incisor, all warm injection molded, and remove the matrices. And then we start shaping these teeth to look like lateral incisors. This is the central incisor, this is the lateral incisor. And so we're going to fill in this little groove with some flowable composite. and then we get the 4 front teeth looking pretty close to what natural front teeth would look like. Remember, we plan to be a little bit longer, and we plan to be a little bit brighter and a little bit bigger for this Catherine smile. So 4 front teeth are about 80% done at this point. We look at them from all angles to make sure they're shaped symmetrically and appropriately to each other. And we look at how they fit within the lips.
With contouring and finishing, we get to 80% done to make sure our teeth are the right size and are fitting into the lips properly before proceeding on to the side back teeth. So we finished building the 4 front teeth, and now we're going to build the width of the smile going back towards the molars.
And then we start doing the eye tooth, or the cuspid tooth, which is the 3rd tooth from the front. We use a little different matrix for this, but we warm inject and place our U-veneer and make sure our U-veneer fits into the area. And then this is our cuspid finished. And then we do the bicuspids because we're filling out her smile all the way out to the back, so it's full. And so again, wedges and matrices, warm inject, and then now our bicuspids are almost done. We need to add in here, so we do that. And then we make sure the shape and the flow of the width of the smile is nice and symmetrical and even. And then now we have this side done, and it's nice and full at about 80%, and we have to do her right side. And we want this line to be all even, and so we'll be working on that as we go. Start working on the other side. Make it look like her left side. Now we're making sure that our edges are even. So we want the central incisors to be even, but the laterals to be slightly shorter, and then the cuspids to be the same length as the central incisors. So on this side, as we work on it, we're going to bring this down here. We're going to bring this down here. We're going to bring this down here. I use this occlusal plane guide to help me do that. Now we're all done. This is kind of how they looked. And we're happy with the width, and we're happy with the symmetry. And we take some photos to criticize our work. Like, I'm not happy with the way this is polished. I'm not happy here. I think we're a little bit too far out there. I think we're a little bit too far out here. We might be a little bit long. And so we put together a drawing, and I mark the places I need to correct based on photography, because a lot of times you can't see it with your eyes. So photography helps me, and you should have anybody that's working on your teeth be a good dental photographer, because then you know they're going to be able to see their work and criticize their work and make sure that they can improve any work they do on you. These were my drawings as to what I needed to correct for her. So I'm going to be correcting these and polishing in the appropriate places. My notes, widen and open these little V's, we call them braziers, to make sure the teeth look separated and natural. Polish up any areas that didn't get cleaned up, and then polish these areas that didn't get cleaned up.
So a smile goes from the width of the lip on one side to the width of the lip on the other side. And there's so many details to worry about in between. And I hope you can see how we take care of that in our office. In the next segment, we're going to go over Catherine's final result, and you'll get to see how she got a broad, wide, and white smile without grinding on her teeth.
So now we have her smile about the way we want it. Up those areas, and this is what Catherine Smiles looks at the end. So as you can see, this is a great change for her. The teeth are a little bit brighter, they're a little bit longer, her smile is full, but yet it looks very natural on her. And this is the close-up after doing all the changes in the polishing. And again, we got some added length, we got some added width, and then we got some symmetry. Side view, and then this is Catherine live. And you can see her smile's a little bit bigger and brighter and fuller. And it fits her lips really well, and she was extremely pleased. This was her imaging, if you remember. It was a little bit too bright. And then this is her imaging to her natural finish. We wanted a little bit darker than this, but brighter than this, and I think we hit a home run when we picked the shade for her. So Catherine was very, very pleased with her smile. Again, our imaging versus her natural smile. And she allowed us to place a little story about her on our Instagram page so that we can tell other people that they can get a great smile without having to grind on your teeth. So BioClear Uveneers are really a great way to go to give you a brighter smile, a natural looking smile, without having to grind on your teeth, and yet be nice and strong and nice and stain resistant. So I hope you enjoyed my demonstration of what BioClear Uveneers can do for you and how you could save your tooth structure and save money and still get the great smile that you're looking for. So if you're interested in a consultation, we do them both virtually via Zoom or live. They're both no charge, so that you can find out what it would cost or what would be involved and what is possible for you to have a better smile while saving your tooth structure. Thank you very much.
There are many ways to contact us, either through the phone or through our email, or sending us pictures with your email so we can get back to you with an estimate and the possibilities for your smile.